Sarah McLean, and I'm the Executive Director of Project 31, and our guest today is Lindsay Jackson. She is from SSM. Thank you, Lindsay, for being with us again. She has been a regular here on the Peak River Roller Coaster. We've been doing this series called Chemo 101, and she is an amazing nurse that teaches a lot of her patients at the hospital where she works, and so we asked her if she'd come on and do this series with us. So if you've been watching, you know the different things we've been talking about, but today we're going to be focusing on the cognitive dysfunction and neuropathy. So first, let me just say welcome. Glad you're here.
Thanks for having me.
Okay, so let's start off. I hear this term a lot, and it's called chemo brain. So tell us, what is chemo brain?
So chemo brain is a kind of short-term memory brain fogginess. We've all experienced walking into a room completely forgetting why we walked in there. It's similar to that. Unfortunately, it really affects the verbal centers of the brain. So trying to come up with a word or a name in those moments can be really frustrating.
Mm-hmm.
But yeah, it's just kind of like a brain fogginess.
And it's just because of the drugs? It's why?
Because of the drugs. So a lot of people freak out because they're like, oh, is this my aging? Depending on what age you are. No, it is related to your medications. It will start to get better after you complete treatment.
Okay. So are there things, we just talked about the chemo is contributing to it, but is chemo the only thing that causes chemo brain, or is... No. Okay, what are some other things that can cause chemo brain?
Stress, anxiety.
Yeah.
We all, when you're anxious in a state of anxiety, which is very common with a cancer diagnosis, your focus gets very narrowed. And so that can make it worse. Those other big emotions, lack of sleep. If you're not sleeping well, your brain is not functioning great. And if you're not, getting out, moving your body and not eating enough, that can make all of that worse.
Which I think that's a good clarification, because I hear a lot of people who have not had chemo, they don't think that they have chemo brain. And so I think that that's important to note, that stress, lack of sleep, a lack of movement, and, food intake, all of that contributes to it. So how do you manage chemo brain?
Great question. So the biggest thing I tell my patients, if you're not sleeping, you're not able to heal appropriately. You're not able to have the strength to fight this disease and your treatment. So if you're not sleeping, that's a conversation with your physician. You've got to be getting good rest. Make sure you're getting adequate nutrition. We really focus on protein, and a good rule of thumb is 1 gram of protein per kilogram of weight. Easiest way to figure that out, whatever you weigh on the scale right now in pounds, cut that in half.
Okay.
You want to aim for that many grams of protein. It's a lot. Most of us don't get anywhere near that, so you just want to really focus on increasing your protein. We have here in our facility nutritionists on board on our team that deal with our patients. You probably have that at your facility, somebody that can help you walk through that, or pamphlets, or some kind of resource that they can get you. There's online resources, free nutrition through some websites. So yeah, sleep, and then like I said, managing your stress. So getting into counseling, journaling, meditating, yoga, going for those mental health walks every day.
Community.
Your community, absolutely huge.
Yeah, I think when you were talking about that with the food intake, what are some good options? And I know we've kind of touched on this on some other episodes, but just to reiterate it here, when you don't feel well and you're taking chemo, that's really hard, especially. And if you're having a lot of these side effects that we've been talking about, what are some ways that you can try to supplement if you're just not able to eat a lot of food?
Yes. So I've heard from most patients, colder foods are easier to digest. They sit easier. Cottage cheese, like the full-fat cottage cheese, is very high in protein. Those protein yogurts are great.
Okay.
Everyone focuses on, I want good protein supplementation. The problem is, if it doesn't taste good, you're not going to eat it. So I always tell my patients, the best protein is the one you're going to consume. And if that's the Carnation Instant Breakfast, that's 15 grams, but it tastes like chocolate milk, and you can eat that 3 times a day, that's what you want to have.
Yeah.
So don't aim for those huge, bulky proteins like the bars with the 35, 45, because those can give you constipation, diarrhea, bloating. Just focus on just little things. Add some peanut butter to your toast or to an apple. That's great protein. Get you a Brahms shake and put a protein shake in it.
Yes. Yes. I just talked to a patient. That's exactly what she does, because it's so hard for her to keep anything down, and she loves ice cream right now. So I was like, whatever you need, then do it. Just pour the protein shake in there.
Pour the protein. If you like peanut butter, put peanut butter on that chocolate protein.
Yes. Okay, so we had talked about originally neuropathy. What is neuropathy?
So neuropathy, some medications can cause like a tingling or numbness in your extremities, your hands and feet. If you've ever had your foot fall asleep and then wake up again, that pins and needles,
Mm-hmm.
that is typically what it feels like. It can also present as balance issues. So you're running into doorways or you feel kind of, off balance when you go to stand up. Grip strength weakening. So maybe you're dropping things all the time and you don't know why, or it's really difficult to zip up or button. That can all be signs of neuropathy. Ringing in your ears.
Okay.
And it's basically just the way the medications work in your body. Sometimes there's a little bit of damage to those nerves
Okay.
that you can experience, and those are some of the symptoms.
So is that something once the treatment is over, will it start to dissipate? Will you resume normal activity? Is it long lasting?
Most of the time, it will. Some may be permanent. If it gets too bad, you may have to stop or change treatment, because you've got to look at the quality of your life versus the treatment that we're giving you.
Mm-hmm.
There's a lot of things that your doctor can do to help. There's medications like gabapentin or Neurontin that they can send in to help with those symptoms. Some physical therapies are very helpful, especially if it's like balance issues.
Mm-hmm.
One of our physical therapists even does like taping with physio tape to help relieve that numbness and the tingling.
Mm-hmm. I've also known some people that have done some of the nerve renewal type clinics. Those can help for some people too. I don't know. It doesn't work for everyone, but I think sometimes depending on the severity of it, it can be something worth trying, because I know it can be so discouraging and debilitating even that you're just desperate for some kind of option to try to help. So I know some people, they're already coming into this journey with neuropathy. So what do those people need to do?
They need to let their doctor know immediately if it gets worse. And that's a great, I'm glad you brought that up. There's a lot of other things, diabetes can cause neuropathy.
Yeah.
There's other comorbidities that can. So if you start experiencing it new or it starts to worsen, you've got to let your physician know right away so that they can address it.
So you just mentioned it about the physical therapy and the tape. Are there any other things that you can do to be managing neuropathy? Because I know, like some of my girlfriends have talked about, it's hard for them to even get their mascara on because they can't hold the wand, or it's hard for them to drive because they can't feel their foot sometimes. So it can be scary often. So are there anything else that we can be doing to manage that?
So some of my patients do cryotherapy or cold therapy. They will either, some of them have frozen water bottles that they hold, or there are actually gloves and socks you can buy online. You can do ice bags. The research there is very limited, but some people swear that helps. And so most facilities can help accommodate you. For ours, you have to bring in your own things to do that, but we're happy to put them in the freezer for you or get you ice or cold water or whatever you need for that.
That's a good point, because I do feel like some girls, they do bring the gloves and they have the bags of ice that they put their feet and their hands in, and then some people even do cold capping to try to preserve their hair as well. But like you just said, in terms of research and even in the personal experiences that you've had with patients, do you see a lot of results from that?
So as far as the cryotherapy, it's really hit and miss. It can be very uncomfortable. And you think you're here for hours, and you're not wearing them the whole time you're here. You wear them for a few minutes, you take them off. But it's like you want to be on your phone or you want to be reading a book, and that's kind of difficult. Plus, it's cold. It's not fun. But two, I'm a huge proponent of the placebo effect. Our brains are amazing at healing, and I think for some people, just knowing, hey, this is working, your brain, amazing things can happen.
Yeah.
So I have had a few patients do it. I've not had anybody able to get through their full treatment while doing it. But they used to do it in the beginning.
I agree with you too, though. I do think there's a certain level of placebo that, if it's working or not, hey, at least we're trying. And if I think it is, and I feel better afterwards, then that's 100%. Great. Yes. Yeah. But I just want to encourage anybody that is experiencing chemo brain or neuropathy to please don't suffer in silence, that there are different options of things that you can look at that you might not even know are available to you. I feel like, as we've even talked, things are always evolving, and people are always, sharing new ideas and new ways and new resources that could help you hopefully get some kind of relief. When you were talking about, I want to wrap back around with the chemo brain, and you were saying that it's important for the sleep. And I know a lot of ladies, they experience insomnia because of the chemo. Do you have any recommendations for that? Obviously, to try to get that restful sleep.
Yes, so we've got to find the cause, right? Are you on a regimen where you're taking oral steroids, and are you taking them too late in the day? Maybe we can adjust. If you're on dexamethasone as part of your treatment for your nausea, we need to maybe take that earlier. Do we need to start on melatonin, or do we need to get you something for sleep? Are you drinking caffeine too late in the day? With your chemo here, you're getting a lot of fluids. So is it you're just getting up to go to the bathroom 5 and 6 times in an evening, and maybe we need to stop like our oral intake of fluids earlier in the day? There's absolutely things, exercising at the right times of day. You don't want to exercise too late because that's going to keep you up.
Okay.
Maybe, or instead of walking in the evenings, doing some yoga and stretching and like winding down. Putting your phone away, getting rid of those blue lights in the bedroom is huge. Having routines are great for both. They're great for insomnia, and they're great for that chemo brain. So your wallet, your purse, your phone, same spot every morning, your routine in the evenings, putting everything away, having a bedtime routine. You don't want to stay in bed if you're awake. So if you're awake longer than 20 minutes, we need to get you out of bed.
Oh.
Go do anything else. Go read, go sit for a minute. It's preferable if you're not on a screen.
Okay.
But go, and then because you don't want to train your brain that so starts to associate insomnia with your bed.
Okay.
So
That's a good point.
Hop up out of bed, go somewhere else in your home if you're able to, and do any other activity, calming activity. Things like chamomile tea.
Yeah.
Works great for some people. There's lots and lots of
resources available for that too. Yeah. Okay, one more question on the neuropathy. Does it matter the type of chemo medication that you're taking? Do certain drugs cause it more than others? Do certain types of breast cancer or staging have any effect on the potential, level of neuropathy you may have?
So your taxanes, which a lot of you ladies take, things like Taxol, your paclitaxel, your docetaxel, those are really high risk for neuropathy.
Okay.
Yep. But it is medication dependent, yes.
It is. Okay. So that's important, ladies, for you to be aware of, just because, as she just said, if that is going to be a part of your regimen, just so you have, the tools in your tool belt to be able to ask the questions that you may need to ask to have resources available so you can make good decisions and kind of prepare along the way. But, I just want to thank Lindsay again for being with us. It's been so insightful for me just being in this for so long and just seeing how things always evolve and things that we're learning. And I just appreciate you being willing to teach everyone. And if you guys have any suggestions or questions, feel free to reach out to us at info@project31.com. Lindsay will be happy to answer any questions, I'm sure. So we're always here for you, and we hope to see you next time. Thanks for joining us.
Have a great day.